And now to health matters. A team of medical experts and civil society organizations have vehemently condemned the pronouncement of the World Health Organization, WHO, made earlier this month declaring monkeypox, MPOX, a public health emergency of international concern. Recall that WHO has begun to sound the alarm over MPOX potential for further international transmission, calling for a series of preventive measures to be stepped up. At a press conference on Monday in Lagos, the CSOs and medical experts fell at what they called a poly by the WHO to push to Africa and Nigeria, especially a new vaccine which may have health hazards on the people. The group maintained that there was no fact that Nigeria needs the vaccines for MPOX because in Nigeria, the mortality ratio will remain 0.
There's no proof to the fact that we actually need these things. So essentially also, it's treatable. It's treatable. There are therapeutic regimens for this, and that just closes up the question of having to have widespread vaccination. This means that you're giving medical substances to people who may not need it, and every medical substance is potentially something that could cause an adverse effect because it's not natural to you. So, and in medicine, I've said this a million times, it's always first do no harm. First do no harm. First do no harm. And if there's any chance, 1 in a million, that these vaccines can cause adverse effects for people who don't need them, for people who are not susceptible to being killed by this virus in the first place, so why are we doing it? We have very limited morbidity on the monkeypox. We have fever, rashes, and sometimes it blow. In most cases, in the clade 2, which is what is predominant in Nigeria, the clade 2, not the clade 1, it blows over. It's a self-limiting virus, essentially. And that's the reason why you have the 0. The mortality rates speak to that. 0 in the whole of this year. So for something that's self-limiting, we're doing well already. Africa is not always the place where we're not doing well. We're doing well already. In this one, we're doing well already. And what we can further do is what we're already doing. The surveillance, the case tracking and all of that, we're doing that fantastically well already, and we're keeping the numbers low.
Exactly. Let us go to our natural compounds and substances. They have been proven to be helpful. Instead of waiting for those abroad to come and take them from us, why don't we do it ourselves? We'll be sure of what we are doing because we know these compounds. They have a long history with us. It has been studied scientifically. So why are we waiting for things to come in that will harm us? Because these drug companies want to have their drugs freely available and taken by everybody, they continue to bury the harms in these compounds. So vaccination has helped modern medicine, but the vaccines as they are currently created are a harm to humanity. Since now, the MPOX vaccine is experimental because it was not proven to be effective for MPOX.
Let us not invest so much time and money and effort into promoting what is a problem elsewhere than in Nigeria. And even when you look at the global data, it is also not a problem when you look at the data. So we look at a case of, trying to overbloat this problem for the sake of introducing the vaccines. So we already have a lot of problems with the COVID vaccines, not just in Nigeria, but globally. There are a lot of problems. It's everywhere. There are people, you even heard one of our speakers, who took the COVID vaccine and said it that she knows what it is still causing to her to this very moment. And unfortunately in this country, we don't have a database. There is no database of vaccine-injured people.